This is Richard Wolff from Democracy at Work with another Wolff Responds. I want to talk again about the coronavirus and about what ought to be done versus what is being done. Many folks have asked me, what would you do or what would rational society do to deal with the virus that the United States and many other countries are failing to do? Let me give you a brief list of what a rational response would be and then explain why we don't have it. Here's a rational response. The first priority has to be with the medical personnel, those that are helping to control the virus in terms of those who already have it, the caregivers, the first responders. Those people have to be healthy, safe, properly equipped, tested every day to make sure that they are not inadvertently spreading versus controlling the disease. So that would be the first priority, and you would have to do that. No muzzling of these people. If they're working in a facility that doesn't have adequate equipment, they have to be able to say so publicly so everybody knows what the safest place is to go and what the less safe places are to avoid. We have in the United States now hospitals in the middle of a pandemic firing nurses and doctors because they dare to speak to the media about inadequacies where they're working. The people have a right to know, and the hospitals are simply doing that because they're afraid of losing profits, that people who hear that there isn't stuff at the hospital there ought to be will go to another hospital, which they ought to be free to do. It's a case of capitalist profits in a hospital trumping the mass majority's right to know what is healthy, safety, and even a matter of life and death. What's the second priority? The second priority is to do much the same. Safeguard, protect, monitor, test the people we need most after the first responders and caregivers. So there should have been, and there wasn't, and there isn't now, a proper way of vetting everybody who handles food for us, the people, everybody who handles medicines for us, the people. Those folks can pass the disease if they have it. So the people who are handling food, they have to be tested. And you can test them in a variety of ways. The Chinese used an interesting example. They had millions of people volunteering to use a temperature gun. It's not 100%, but it improves the odds that you don't let people who have a temperature that might be the coronavirus handle food, handle medicine. There are more than enough people available, especially with the unemployment we have now, to be able to be selective in that way, and that would be crucial, and that should have been done. And the only agency that can do that is the government, not the private corporations who don't want anyone to know if they have an infected worker or 6 or 10, because it'll hurt their profits, which is what they're trained to worry about. When we've done with making sure, and by the way, not testing once, every day test that the temperature is all right. As soon as you get a test available, test the workers there. Make sure they are not spreading the disease when they handle the food and medicine everybody is touching and needing to use. Next, do the same for the transporters, the truck drivers, the taxi drivers, the bus drivers, the train personnel, the plane personnel. They come in contact with groups and with materials that the rest of us touch, and so they are the next in line in a priority. Monitor them. Look at their temperature, test them, supervise them, because they are transmission belts if you don't do that. The United States hasn't done it to this day, and that transmission is therefore going on. Let me give you a couple more examples. We have millions of students out of school. We have millions of teachers laid off. What are they doing now? They could and should be doing something as important as continuing the education of our next generation. If you can't assemble students in a classroom, there are other ways of teaching. One of the most famous is called one-on-one tutorial. A teacher meets alone with one student, 1 hour a day, 2 hours a day. We have millions of teachers who could do that. We have millions of students who could do that. We could commandeer all of the empty stores, empty restaurants, empty warehouses that now exist to create the space where a tutorial, where the teacher is a good 6 to 10 feet away from the individual student, and it all could be monitored by a third person equidistant from the others. It just has to be organized. And what could be more important than continuing the education of our students? Instead of paying unemployment to teachers so they sit there, how about paying the teachers our ongoing salary for work? And since tutorial takes more teachers, let's take some of the millions of other people unemployed and convert them into tutors. Come on, set up the system. And if those people need a little refresher on how to be a teacher, every morning for an hour or two on the internet, you could get someone to explain to you what the lesson plan today is. In English, in arithmetic, in biology, in history. It really doesn't matter. It's a very important function for the teacher, for the student, and for a society that wants to keep the learning process going. Why haven't these things been done? Basic answer, bottom line. Because it interferes in the private profit system. It would reorganize the economy, not to convenience profit, not to convenience profit in the short run or the long run, because there are more important things than the private profit of a minority. It's the health and the very survival of the majority. All of these things and many more that an intelligent American population could and would do for themselves are not being done. That's not because of the virus, and that's not because we lack the capability or the resources to do it. It's because we are stuck in an out-of-date, archaic economic system called capitalism, which wants us to pretend that what's profitable is what's good for us. And what the coronavirus teaches us is exactly the opposite. What's good for us is to throw aside the values of capitalism and deal with our own human needs directly. We could and we should. This is Richard Wolff for Democracy at Work.